Hello, everyone. My name is Gil Hardy. I'm Emeritus Professor of Clinical Nutrition in Auckland, New Zealand. Today's topic is just one in a series of subjects brought to you by Channel 1 on-demand nutrition education. Today, we're looking at photoprotection of parenteral nutrition from an international perspective. Our learning objectives are to understand the effects of light and air exposure on PN components, to identify the light sensitivity of PN components, notably micronutrients, evaluate current practices for photoprotection of all parenteral nutrition admixtures in countries outside the United States, and to understand the rationale for these international practices and recommendations for photoprotection of all PN mixtures for adults and infants. The topic has been in the literature and in discussion at conference for a number of years, and this resulted in a group of highly respected experts in FASPEN producing a position paper published in 2021 recommending photoprotection of parenteral nutrition for premature infants. When asked to review this, I thought, well, that's fine, but does it go far enough? And I consulted many of my colleagues around the world, and we decided we should complement the FASPEN position paper with our own paper from an international perspective, and that's also published in Nutrition and Clinical Practice. So let's take a look at the recommendations. Of the 9 recommendations made by FASPEN, I've selected 4 here that are particularly important. In vitro testing indicates that PN integrity is optimized with light protection. Also, in vitro data indicates that partial photoprotection of parenteral nutrition products reduces markers of oxidative stress. And then clinical data, including a meta-analysis, suggests that photoprotection of PN admixtures and intravenous lipid emulsion reduces the indicators of oxidative stress in preterm infants. So this led to the recommendation for photoprotection of PN for infants, but FASPEN group at that time claimed insufficient information exists to inform the recommendation surrounding photoprotection of these PN admixtures when administered to older children or adults. They did note, however, that sufficient evidence suggests that PN components utilized in children and adults are susceptible to photooxidation. In the executive summary of the FASPEN paper, they stated premature infants appear to be most susceptible to the peroxide formation, and this occurs when intravenous lipids, amino acid, vitamins, and trace elements are exposed to ambient light and phototherapy. Failure to protect these PN admixtures, whether they contain lipids or not, from light exposure can increase the generation of peroxides. And complete PN photoprotection from light, that includes bag and infusion sets, is more effective than just partial protection of the bag. So, as stated earlier, FASPEN recommends complete photoprotection beginning as soon as possible during the PN compounding process and to be continued until the entire infusion is complete. So our question was, in that case, why not simply advocate light protection for all PN? And this presentation will aim to support that suggestion. So let's look at the nature of light and peroxidation. Peroxidation is a chemical reaction that depends on the presence of light and oxygen. So peroxidation, as the name implies, rarely occurs in the absence of oxygen. Most photochemical reactions are caused by light in the energy-rich UV wavelength, of which daylight is the principal source. And photodegradation losses will lead to micronutrient deficiencies over time. So these statements are all well established and very important. Way back in the maybe almost 25, 30 years ago, this cartoon shows quite nicely how free radical formation can occur from the action of light onto oxygen, producing a superoxide free radical, and then the hydroxyl free radical that in turn can start to oxidize polyunsaturated fatty acids and several vitamins. And there are 3 publications there from around this early time from Switzerland that showed formation of lipid hydroperoxides depends on temperature, light, bag material, and the kind of emulsion. From ourselves in the UK, light protection and oxygen exclusion are key factors that can decrease peroxide formation. And then some colleagues in New Zealand that showed that limiting light-induced lipid peroxidation can be achieved by adding vitamins to the PN. I thought it'd be interesting to run through some of the historical data that supports our argument, going back to the pioneers of all-in-one parental nutrition in Montpellier, France, by Professors Solisol and Joyer in the early 70s. They were filling their PN under nitrogen gas into silicone rubber containers, as shown on the right. And so they were, without possibly even being aware of, protecting their PN components from light. And during the 80s, together with my colleague Michael Allwood and other colleagues in Italy, we reported on the influence of light on vitamin A in particular, and then were able to measure the oxygen content of PN and show that this could be minimized if multi-layer oxygen impermeable PN bags were used. During the 1990s, we continued looking at susceptibility and stability of micronutrients to light and peroxidation. Stefan Mulbach and other Swiss colleagues described the sensitivity of intravenous lipids to light and micronutrients. And the New Zealand researchers showed that phototherapy in the neonatal intensive care unit could be protected, could be minimized with ambient light protection. And the pioneer in the United States of parenteral nutrition, Dr. Stanley Dudrick, shown here with one of his patients, age 9 and age 13. Again, in those early days, parenteral nutrition for the children were included in a vest, so they were protected from light, or later on in a backpack. In Germany, working with myself and Baxter, Professor Müller in Cologne, started the first home parental nutrition program. Again, you can see in the cartoon on the right, the bag was inside a bag, a carrier bag that again protected from light. Moving on to the beginning of this century, then we continued investigations in various vitamins, and on the right, one of the most dramatic changes is in vitamin C, ascorbic acid, in EVA bags, which are semi-permeable to oxygen and weren't light protected. And the graph there shows how quickly degradation can occur, whereas when protected from light and oxygen in the bottom graph, it stabilizes. In Australia, where the hot noon Australian sunlight can affect PN stability, Mel Davis showed that it was 100 times more effective if the cover bag, the overwrap, was sealed. A South Korean study where all their PN was light protected recommended that air should be excluded, with data supporting that. And again, New Zealand researchers showed that covering the administration set in the NICU with aluminium foil minimized light-induced peroxidation. So the evidence is starting to build. This was a study that we carried out in the UK some time ago, where we compared standard regimens there using Synthamon, which is known as Travasol in the United States and elsewhere, and a mixture of electrolytes, vitamins, and trace elements. Compared, 3 overwraps were compared to a control completely in a darkened room, as shown on the right here, and we measured the levels of vitamin A and E, tocopherol and retinol, and their activity over a 6-hour time interval. So in the darkened room, the time interval data recorded was greater than 6. With no light protection, the levels you can see are quite low, but with the brown overwrap, excluding light, then the levels were almost in line with that in the darkened room control. So this supports our rationale for light and air protection of all PN. And those of you that are pharmacists will know that there is a responsibility to dispense medicines in the right dose to the right patient and at the right time. To fulfill this responsibility, we would argue that best practice to minimize loss of nutrients in all PN is by light protection, to dispense the right dose of micronutrients and intravenous lipids, prevent complications from nutrient deficiencies, and hence to optimize patient safety. So can we reduce oxygen radicals associated with PN? This elegant paper from Europe shows quite clearly in the cartoons that with complete shielding, there is good protection, not so much with partial shielding, but still the level of oxidative stress created is still around half of that with no light protection at all. So the answer to the question is certainly yes. So based on these data, internationally and in many countries for over 20 years, these simple practical measures have generally been adopted to minimize light catalyzed peroxidation of parenteral nutrition components. 1, to use air impermeable, multi-layer PN containers to remove as much air as possible during the PN compounding process. In the UK in particular, to incorporate vitamin C in the PN regimen to remove dissolved oxygen. And lastly, fairly unanimous agreement that to cover all PN containers with a light impermeable overwrap. So this led to us in the UK, I was working in the UK at the time, to recommend light protection for all PN, followed by Brazil, Mexico, Australia, Poland, and so forth through the years, leading up to this, the FASPEN recommendation and the discussion in this presentation. Another major publication by an expert FASPEN group looked generally at PN stability and compatibility, published in the journal JPEN in 2022. And their general statements, again, impinge on light protection. Incompatibility depends on oxygen and light. Stability of the important vitamins include light exposure, pH and temperature. Degradation reactions are enhanced at higher temperatures and upon exposure to air and light. To prevent possibility of ascorbic acid loss, PN admixtures should be protected from light whenever practical. And to prevent degradation due to light exposure during administration, PN bags should be wrapped with an opaque protective covering. So these general statements are also important for the stability of our parenteral nutrition mixtures. A couple of years ago, the FASPEN, the European Society of Parenteral Nutrition, published their recommendations and guidelines for micronutrients. And you can see from these lists, the majority of vitamins are unstable to light. And similarly, an FASPEN recommendation, the stability paper, also included most light-sensitive vitamins. So our paper that we published was co-authored by 40 experts, representing 6 national societies in 20 countries, as shown here. And you can find, if your country is in those, on this world map as we see it from New Zealand. So to summarize and conclude, the 2021 FASPEN position paper is very well researched by an expert group and provides an excellent review of the hazards of oxidative stress when PN is exposed to light and oxygen. FASPEN at that time could only recommend photoprotection of PN for intravenous lipids for neonates because insufficient information exists for advising photoprotection for older children or adults. They did, however, comment that sufficient evidence suggests that the PN components utilized in children and adult PN are susceptible to photooxidation. And so to make our point, I like to use the science of the obvious as proposed by Dr. Mike Strode, who was a previous chairman of the British Association of Parenteral Nutrition. And he always uses this cartoon to state the obvious. Do we need a randomized controlled trial to confirm that a parachute saves lives? I think we would know the answer to that. And so likewise, I would suggest, do we need an RCT to confirm that light protection of PN improves stability of nutrients? We light protect our beer, our wine, our oral vitamin and parenteral vitamin supplements. So why not light protect all our patients' nutritional lifelines? Let's keep it simple, stupid, and follow the KISS principles. Based on more than 40 years of international experience, we question whether the FASPEN recommendation for light protection goes far enough. To support this, 5 out of 6 of the executive summary of recommendations for light protection by FASPEN can be applied to both adult and infant PN. And the later FASPEN and FASPEN guidance on stability of parenteral nutrition, particularly vitamins, confirm how light sensitive many of the vitamins are. So let's simply advocate light protection for all PN and keep it simple. Thank you once again.